Hi, this is Dr. Laura Phan, and I am an occupational plastic surgeon. This segment, we're going to talk about a patient who I did a couple procedures on, particularly for the upper lids. We did a ptosis repair or a revision of a ptosis repair, and then for the bottom lid, we did a retraction repair via lateral canthoplasty. This is a patient who had ptosis repair internally, and she feels that her eyes still look sleepy, as well as she doesn't see as widely or brightly as she could, especially when she lifted her eyelids up. So we did a repeat ptosis repair, but externally, so that means making a cut on her eyelid crease, going into the eyelid through 3 layers, the muscle that closes the eye, a protected layer called the septum, and orbital fat. Now we reach the muscle that opens the eye called the levator, and we shorten the levator muscle to make that muscle tighter and therefore more contractile, which produces force to lift the eyelids up. So after the procedure, you might notice that there is a greater distance between the eyelash line to the light reflex on her cornea. So pre-operatively, she had a couple millimeter of distance from the eyelash line to the light reflex on the right, and just a millimeter on the left. After procedure, she had at least 3 millimeter of distance from the eyelash line to the center of the eye on both sides. The contour of the eye also, especially on the lateral aspect, that means from the light reflex going towards the ear, that contour, that shape was also lifted, so it doesn't have such a downward vector. By raising the eyelids up, it allowed the skin fold to come down, and so the hollowing in her upper eyelid subsided, so especially on the right side. So pre-operatively, that's the photo up top. You might notice that she has a deep groove in the superior sulcus, and that's from hollowing or lack of orbital fat there. But once we raise the lid up, the skin fold drapes downward, and it reduces that superior sulcus hollowing. In general, hollowing makes us look tired or not as healthy. Plumpier eyelids, not too full, but plumpier eyelids generally gives us a youthful look. Now going down to the lower lids, we did a lateral canthoplasty to raise the eyelid up, especially in the 2/3 lateral. Lateral means going from the midline going out towards the ear. So we want to raise the contour up in the 2/3 lateral by making a small incision, no more than a centimeter, even less, from the corner out, and then putting a suture at that very lateral corner in the eyelid, and suspend the eyelid up, anchoring that suture to a lining called the periosteum. There's a lining on top of the bone called the periosteum, and we're going to anchor the suture to that periosteum, and that helps lift the corner of the eyes up. And that takes away that downward vector that we see in the lateral corner of our eyes, and that kind of makes me think of a sad puppy eyes. Once the eyelids are lifted in the corner, the eyes, in general to me, looks more engaging or lively. The functional reason to do this lift is also to reduce the overall corneal exposure to air and therefore minimize the symptoms of dry eyes. So in the upper lid, we raise the lid up, but if our lower lid is retracted downward, then overall the corneal exposure is increased such to the point that the amount of tears that we're producing is not enough to lubricate that corneal exposure. So we want the benefit of lifting the upper lid, but we don't want to exacerbate our dry eyes. So then we lift the lower lid up, kind of keeping our overall opening as stable as possible, minimizing the corneal exposure. In her case, we are improving the form of the eyes as well as the function of the eyes. By reducing the dryness, she's now symptom-free, meaning she's not feeling dry, burning, or gritty with her 2 or 3 times of eye drops. For some patients, lifting the retracted eyelids can take away the need of eye drops. For some patients, it will allow them to be at their baseline to prior to ptosis repair. Hopefully, this helps you understand what has transpired between the pre and post-op photos. If you have any questions, feel free to write in the comment and I'll do my best to answer. Thanks for joining. I'll see you in the next video. Bye.